Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Restricted diffusion. So restricted diffusion, what is it? It shows a signal opposite to that of the CSF. So signal is totally opposite to that of the CSF, and a CSF it appears white. It is white, and then the pathology it appears black. It appears dark. Now, or the CSF, if you see the CSF, it appears black. Next is the pathology appears white. So CSF appears black and the pathology it appears white. Now, what is the example? Example of restricted diffusion, you can use the acute infarct, as well as there can be the high grade tumor or the epidermoid cyst, and also the abscess. To learn and grow daily like this, please do subscribe.